Before modern anesthesia machines, before electronic monitors, and long before today's operating rooms, anesthesia was a high-risk craft, practiced in uncertainty. In that environment, nurses stepped forward, not to replace medicine, but to make surgery safer. Their work laid the foundation for what we now know as the certified registered nurse anesthetist. Modern anesthesia began in 1846 with the first public ether demonstration in Boston. For the first time, surgery could be performed without pain. But early anesthesia was unstable, unpredictable, and often dangerous. There were no monitors, no standardized dosing, only constant vigilance. That gap would define the future role of nurse anesthesia. One of the earliest nurse anesthetists was Sister Mary Bernard Sheridan, working in the late 1800s at St. Vincent Hospital in Pennsylvania. She is often recognized as one of the first nurses to specialize in anesthesia care. Then came Alice Magaw. At St. Mary's Hospital with the Mayo physicians, she transformed anesthesia practice. Magaw is known as the mother of anesthesia. She administered thousands of anesthetics with remarkable safety and carefully documented her outcomes in detail. Her work showed something powerful, that anesthesia could be both safe and systematic. Over 14,000 cases were analyzed in her reports, at a time when surgical mortality was still common. As surgery expanded in the early 20th century, so did the need for trained anesthesia providers. Agatha Hodgins became a defining figure. She trained at Lakeside Hospital in Cleveland and later developed one of the first formal nurse anesthesia programs in 1915. Her philosophy was simple but revolutionary. Standardized training leads to safer patients. During World War I, nurse anesthetists were deployed to military hospitals. In chaotic battlefield conditions, their skills became essential. Speed, precision, and calm under pressure saved countless lives. By 1931, the profession reached a turning point. Agatha Hodgins brought nurse anesthetists together in Cleveland, Ohio. From that meeting, the National Association of Nurse Anesthetists was formed. Later, it became the American Association of Nurse Anesthesiology. Early leaders like Gertrude Fife helped organize the profession, establish governance, and define educational standards. This was more than an organization. It was professional identity. At the same time, legal challenges emerged over scope of practice. But court rulings in the 1930s affirmed nurse anesthetist as nursing practice, not the unauthorized practice of medicine. That decision secured the future of the profession. From Sister Mary Bernard to Alice Magaw to Agatha Hodgins, nurse anesthesia evolved through courage, observation, and relentless focus on patient safety. In 1931, with the founding of the AANA, the profession officially took shape. What began as necessity became a specialty defined by precision, science, and trust. And it continues today in every operating room where CRNAs provide safe anesthesia care.